Welcome to another episode of My Story. I'm Papillomavirus Guerrero. In this edition, we're going to learn about an innovative program from Guam Cancer Care in partnership with our public schools and public health department to make sure that HPV vaccines are more widely available directly through the campuses. We're going to learn more after this. Welcome to My Story, the program that shares the trials and triumphs of our cancer survivors, helps support their caregivers and loved ones, all in the name of educating and preventing this terrible disease known as cancer. Papillomavirus Guerrero here with our friend from Guam Cancer Care Outreach Coordinator, Rhythm Bloss. Half a day.
Hi, half a day.
And we're here to talk about, really, at the core of Guam Cancer Care is education through prevention programs, and a nice new effort from Guam Cancer Care, partners like DOE and the Department of Public Health and Social Services, school-based outreach clinics, vaccines being given at schools. I guess what led us to this road to decide that this is the best way to try and prevent, we're talking about cervical cancer today.
Okay, so with our HPV vaccination and school-based immunization program, how it came about was Guam Cancer Care would partner with other nonprofits to host medical outreaches within the summer. And that was for community members who we would try to get through those grassroots who didn't have access to care, or it was just a little bit more difficult for them to get access. And so we would partner with public health nurses, the immunization program, have volunteer doctors, and we would allocate about 4 hours on a Saturday or a Sunday to host a medical outreach for a certain village. Okay. But it got to a point where we would have to turn away thousands of community members. I remember, yes. So one outreach we did at Simon Sanchez had roughly about, had to be 1,000 parents, their children lining up outside before that outreach even began. And just with the amount of time we had, the amount of help we had, we cannot help everybody in that 4 hours. Yeah. And so we would explain to them, like, I'm sorry, due to the time and the volunteers, we have to.
Oh, so you're turning people away.
We had to turn people away.
So this, because I guess maybe I assumed that, you maybe did like one of those traditional outreach clinics that we see like at the center courts of malls and shopping centers, and maybe didn't get the attendance that you expected and thought like, oh, maybe this is a better way to directly reach out. This is the exact opposite. Yes. You're trying to manage the demand here. Wow.
And it was sad to see that there was so many community members that had no insurance or had MIP or Medicaid, and they would come and, children would come with no shoes on, and it would hurt us to see that we had to turn them away because we just couldn't help everybody. And so we sat down with Public Health's Immunization Program Manager, Annette Uggan. We also sat down with the Chief Nurse at GDOE, Julietta Kineni, and we all came together and were like, how can we build a program that would help allow immunizations and vaccines given within the school. And so since our inception in January 2018, we've had our HPV program.
So obviously HPV, the virus that has been shown to lead to certain types of cervical cancer, it's one of the sort of, I don't want to say easy, because nothing is really easy in cancer prevention, but it does seem to be sort of a very direct way to help prevent the incidences of these certain types of cervical cancer, because the vaccination means that you won't get the virus that could lead to cancer down the road.
Yes, and so with the immunization, the human papillomavirus vaccine studies have shown to be cancer preventive. And when we take that proactive approach in your health and you encourage community members and parents to get their kids vaccinated, it is like preventing cancer. It's preventing cancer in our community.
How do, I guess, parents out there of high school age children, what do they need to be on the lookout for in order to take part in this program?
So part of our program, the protocols with that is there is a consent form that is distributed throughout the school health counselor at each school. With the consent form, that is provided by Public Health's immunization program, there is a information sheet about the HPV vaccine. And then also, we encourage parents to use their resources and to find out more and educate themselves before making that informed decision.
So this will be a point that we reinforce with our guests in the next segment, but this is a voluntary program. No one's going to force you to vaccinate your kid.
Yes, so the human papillomavirus vaccine is highly recommended. It is not mandatory for your child to start school.
Okay, so for instance, I think parents of young kids are used to knowing that they need the MMR vaccine before they can enroll. This isn't going to be something like if you don't show your shot record, you're going to be denied enrollment in your school.
Yes.
Okay. Just want to double check that because I think that there's sort of a feeling out there, especially in the nation, about vaccines, and so I do also encourage parents to. There's plenty of literature out there to read about how the HPV vaccine is safe, but because this is a sort of family healthcare issue, I also just want to make sure that we're perfectly clear that this is voluntary. You volunteer for it.
Yes, and that's the mindset we're changing. That we're trying to change here on our island is that when you take the human papillomavirus, the vaccine, and think of it how that it's preventing cancer, so then that mindset shifting is what we're trying to encourage parents, and with the outreach efforts we have on Guam Cancer Care, that's what our goal is.
Not to sort of take you a little bit out of your wheelhouse, but I also think that one of the reasons why healthcare professionals are pushing for the vaccine, checking my male privilege here, HPV can be transmitted to men, but there's no symptoms, and there really is no test to see if a male has HPV. So this is one of those ways to sort of prevent like a giant question mark as we move into adulthood. And with so many things uncertain, I can understand why Guam Cancer Care is trying to sort of prevent this before it becomes an issue later on.
Yes, and with Guam Cancer Care, we have our direct service support for the cancer patients here on our island, and part of expressing our direct support to them is also preventing cancer and spreading cancer awareness and early detection within the community.
So let's talk about, this is the program, the HPV at school, these vaccine clinics. When is the next one? What school should be on the lookout for these consent forms going out?
So as of right now, we have Ukadu for the month of February, that we are going to be attending Ukadu High School on February 28th. And as of March, we will be looking at Southern High and possibly Teton. Okay,
so I guess for Southern High and for the schools that are remaining, consent forms are going to be given out. Is it going to just specific grades or school-wide?
Yes, so it goes out to school-wide. We give the consent forms to the school health counselor at that school, and they will be the ones to disseminate it amongst their students.
Okay, so be on the lookout for those consent forms. All you got to do is fill them out, have your kid turn it back into the school, and when the outreach clinic is happening, they just have to show up to, there's going to be like a nurse or something to administer the vaccine, right?
Correct.
Okay. Now let's talk, this specific outreach program is just part and parcel of the education efforts of Guam Cancer Care. Mm-hmm. You guys are in the schools, starting at the elementary age kids, to instill healthy habits that we know can prevent, maybe our risk of cancer down the road. And then for the older kids, having to better understand this disease that really touches all of us. I think that there is something to be said about giving kids answers can really help them deal with really like difficult situations if they just know what's going on.
Yes, and our elementary, our Kids for the Cure cancer educational program is in the elementary schools, as well as our EFIT ECHO, which is for the high schools. And when you look at the human papillomavirus vaccine, the target demographic is, age group is 9 to 26. And in the schools, you have that captive audience of 9 through 18, give or take. But that's how we are tying it into our education programs as well.
So, again, for the younger kids, we're not talking about like molecular biology or anything like that, but it is like eat healthy, get exercise, and this is going to make sure that you're always healthy, not just when you're a kid. I do like that approach because you're not sort of trying to indoctrinate them
Yeah.
to do one thing or the other, except to instill healthy habits, which, you know, kids are like sponges. They don't really need to sort of know the reasoning behind the good habit. They just need the good habit instilled, right?
Yes, correct.
And then what's different about the education program for the older kids? Because that's when we start to get into that direct education about what is cancer, right? And how is cancer caused?
Yeah, and with the EFID Echo, it's more, like you've said, it's more educating and more aware about how, you know, go in more depth about cancer education and how to prevent cancer. And, you know, we with our high schools, we attend the PTOs, the PTC meetings to help encourage and explain more on the HPV vaccine.
So if people want to support Guam Cancer Care, obviously you have the education programs that do such great work for our kids, but you also have direct patient services that for people, for our cancer warriors out there. So if people want to support Guam Cancer Care, where can they call? Where should they visit?
We are very heavy on our social media as well as our website. We have a website, guamcancercare.org. Our Facebook is Guam Cancer Care. Our Instagram is Guam Cancer Care. And can always give us a call at 969-2223.
Okay, well, don't go anywhere. We're going to be right back. Those partners from the Guam Department of Education and the Department of Public Health and Social Services will let us know more about this HPV vaccine outreach that's happening at our island high schools right after this. Welcome back to My Story. I'm Phil Iangura. We're continuing to talk about a new program in partnership with Guam Cancer Care, the Department of Public Health and Social Services, and the Guam Department of Education. From those government partners, we have Public Health Immunization Program Manager Annette Uggen, Hafaday, and the spokesperson for our public schools, Isa Baza. Hi, good to see you again.
Hi, Phil. Thanks for having us.
So let's talk about this approach. Certainly, DOE is the largest agency in our government, not just because of the amount of employees that work there, but let's say, if you want to say customers or clients, the amount of students we have. I can understand why a nonprofit organization like Guam Cancer Care would identify our public schools as a place for a really effective community outreach to occur. What was the superintendent's, I guess, reaction to the offer, and what's the approach been like to try and implement this, Isa?
Well, you know, as Rhythm mentioned, we do have a captive audience. We have roughly 30,000 students in our school system. And, you know, when Guam Cancer Care and Public Health reached out, of course, any effort to provide additional immunizations to our students is welcomed at DOE. And so we're just glad that they offered their assistance to start this program. And we hope to continue working to provide more of these clinics to our students.
Annette, I grew up with those immunization outreaches that were at the center courts of the malls and the shopping centers. Was there something, I guess, that, like, was there a trigger that happened along the way that made public health and partner organizations like Guam Cancer Care think, like, maybe there is a better, more efficient, maybe a way to help more people, and that could be through our public schools?
Yes, like Guam Cancer Care, our program sponsors their own immunization outreach clinics, and we had the same results of turning away hundreds of individuals, which impacted their ability to start school in a timely manner.
Yeah.
And that is a result because of the amount of nurses we have at these events kind of dictates how many clients we can take in, because we have to think of safety both for the nurse administering the shots, as well as for the number of individuals coming in for immunizations. Average, we give 3 to 4 immunizations per child.
Right.
And so that's a lot for one nurse to administer. And so if we're talking hundreds of individuals averaging 3 to 4 shots at a time, we're looking at upwards of more than 500 doses being administered. And so we just can't meet the demand of having outreaches, even in the walk-in clinics, be it at a private clinic, at our community health centers, or even at Manila Public Health. And so we've unfortunately had to always turn away or cap the number of clients we can assist. And so with Guam DOE having their school health counselors who can help administer shots. And again, this is the ability for parents to give that consent to our program, our project, so that you don't have to miss work to take your child into public health or a
Right.
private clinic, or you don't have to pull your child out of school. We're coming to your school, your child's school, to give it there during school time.
I also think that just the, talking through the logistics with you guys in Guam Cancer Care, it must be so much easier to plan for something when you know exactly how many people you need to serve before and not during.
Yes, because we always want to prepare according for the amount of vaccines we're bringing, as well as the medical supplies, and also how many school nurses are going to assist us, because we want to make sure that this flow is as smooth as possible. Again, we're in a time frame of that school setting, and so we want to make sure that we don't have any delays, that we unfortunately have to turn the student away and we're moving on to another school in the next week or so. And so it's kind of hard to make that round back, because again, like Isa said, there's a lot of competing priorities. Pulling a school nurse out from her school to come to another school, it can be very challenging. And so we want to make the most of our time and provide as many vaccines while we're there.
So Isa, I know that we mentioned this in the previous segment, but it is a point that I want to reinforce, because the healthcare of one's child is a very personal, sort of effort, and certainly we don't want to give an impression that parents are powerless in how they choose to keep their kid healthy. So unlike, let's say, the MMR vaccine that is required to enroll in a DOE school, no one's going to kick your kid out if a parent decides to decline this HPV vaccine.
Definitely, this all goes to the parent. Parent, it's their decision. So this is a voluntary program, and so we do disseminate consent forms, and it's up to the parent. They can review the information provided by public health. It has information about the immunization. They can contact their health providers and make that informed decision on their own, but it's definitely not required. It's an option.
Without trying to court any controversy, Annette, let me overgeneralize a little bit. Vaccines has kind of been a topic, weirdly to me, of debate in the States, more so than here on Guam, yes. Thankfully, in my opinion. We see a measles outbreak in Washington State, and that's something that I wouldn't associate with a place that is thought to be like highly educated, thought to be a place that is liberal. So without getting into people's personal views, let me just ask the science behind the HPV vaccine. Is it safe? Are there any risks, like side effects, that are associated with it?
The vaccine is safe. As with any medication, vaccines may have some side effects for certain individuals. So we always screen, regardless if you had the vaccine already. When you come in again, be it at the outreach or at a clinic, we ask those questions just to ensure there are no potential adverse events to it, because we definitely don't want anyone to have a serious side effect to the vaccine. So screening is always required prior to actually giving the vaccination. And so if anyone has had a serious side effect to it, or they're allergic to something in the vaccine, okay, they are medically contraindicated from receiving it. And so this vaccine has been around for 10 years. It has been proven to be safe. We follow the same requirements. It's a CDC approved vaccine. And with all other vaccines, we screen, we verify to make sure there are no side effects, and are you still able to receive it.
Now, I know that HPV is sort of tied to strains of cervical cancer, yes, but something that you told me during our little chit-chat of a break that we had before starting to film was that the HPV vaccine also prevents other types of cancer.
Yes, and so cervical cancer is the main one because unfortunately we have a high rate. In the US, but also on Guam. The Pacific Islanders have a higher rate of cancer and certain types of cancer. And so this vaccine is being promoted as cervical cancer when it first came out. It was made only available to the females in 2007. However, over time, studies showed that, the males are getting HPV related cancers. And so that's something that they expanded the recommendation to both males and females.
See, I didn't know that, because I just thought, my job as a man was to get vaccinated so that I wouldn't spread HPV. I didn't realize that there were health implications beyond me being a transmitter of the virus.
Yes, correct. And so there's roughly like 12,000 cases of cervical cancer. However, the other 5 types of cancer that are related to HPV infection causes additional thousands of cases. And so there's the throat cancer, and there's, unfortunately, the anal and vaginal cancers that are also related to having infection with the HPV virus. So we definitely want to promote prevention. There is only the cervical cancer screening that is routinely available. And so an individual may not know they've been infected until years down the road when they have other health problems. So definitely want to prevent it versus having to treat cancer, which again, we're talking serious complications and medical and psychological challenges treating cancer versus preventing it.
Now, you did mention screening, and because there is no silver bullet to cancer, even following getting the HPV vaccine, I think that doesn't stop preventative measures like screening. So women who have even received the vaccine should continue to get screened for cervical cancer with their doctor, right?
Definitely, that's a very good point. Again, just because you've been vaccinated does not mean you need to stop cervical
You're
cancer.
not immune from cervical cancer.
Not. There are other types of HPV out there that you can still have other HPV-related cancers that you can get even though you're protected from cervical cancer. And so again, you definitely want to continue screening even though you've been vaccinated for that HPV virus.
Issa, a lot of this does come down to education, and I know that DOE is partnering up with Guam Cancer Care to have that elementary school curriculum that they have, the high school curriculum that they do have. I know that the superintendent is one of the best communicators directly with students that I've ever seen, and that's coming from someone who's a product of the public school system here on Guam. What is the approach to what is DOE going to do to either internally or with external partners to try and make sure that we hammer down this message home about what can be done to prevent cancer, what healthy habits we can instill into our kids to just to help prevent increasing our risk for cancer as we get older?
So in addition to assisting Guam Cancer Care with outreach through the radios, we've also been disseminating messages home to parents with information about the HPV clinics and the HPV immunizations. I know Rhythm has also been reaching out to our parent-teacher organizations and attending parent-teacher conferences to also meet directly with the parents and explain these clinics, explain the immunization to help them understand the immunization and make that decision for their child.
Well, again, I think this is a demonstration that it takes a village to help tackle this island-wide. It's a worldwide problem, but everyone on Guam has been touched by cancer in one way, shape, or form. And I'm glad to see that this sort of relationship between Guam Cancer Care, our public school system, and our public health department is really, manifesting itself in a way that is moving forward. If people want to learn more about the vaccines that are available, Annette, and maybe they think that because they're uninsured or underinsured, that sort of takes them out of the realm of disease prevention, what's the way of getting hold of your program?
Our phone number is 735-7143. And also you can go on to the CDC website, cdc.gov/vaccines, to get verified information, accurate information about vaccination and their safety. And again, this program is free for those who are eligible, and it's at the school. So
can't beat that. Issa, if people want to learn more about this particular program, should they reach out to their individual principals?
So they can reach out to their individual school nurses.
Okay.
They can also reach out to Guam Cancer Care and the Department of Public Health.
Well, this has been yet another, I want to say, very educational and eye-opening episode of My Story. Thank you for joining us, Philly Young Girl. Maybe I'll see you soon. We'll just have to see what's in store for us. Thank you so much, Issa. Thank you, Annette. And thank you to Rhythm Bloss and Guam Cancer Care for being with us tonight. We'll see you next time.